Okay, good evening, everyone. Thank you for your patience. This is the September meeting of the Health Hospitals and Social Services Committee. And it's 7:22 p.m. And would like to call the meeting to order. We'd like to start with a welcome and a roll call. And so I am Dr. Wayne DeBeetham. I'm chair. I am present. I would hope that.
Not a given.
We have Chittapilli. We have Sebastian Chittapilli, present. Dr. Julia Gomez.
Present.
Okay, Rabbi Bob Kaplan is absent. And our newest board member, Steve Matthews, is available with us via Zoom. And we also have the privilege of having Julie Reyes, who is our chairperson for CB8. Thank you for being in attendance.
Thank you.
And we also have a guest with us, Mr. Ray Pultinas of the JBOLC, who will be speaking with us a little bit later on a matter of a SAPO application, and we'll be hearing from him shortly. I think the first order of business would be the approval of meeting minutes from, thank you for all the members of the community who are present. Thank you for attending. We will do approval of the minutes from April, May, and June of this year. Has everyone had the opportunity to review them? And we also have copies.
Motion to approve.
Okay, we have a motion to approve the minutes.
Second.
Is there a second? Okay. So the minutes from April, May, and June of 2025 are
I was gonna take the vote thing for you, right?
I'll
Also
take
the votey thing.
all right. The next order of business is the chair's report.
Sorry, Mr. Chair, I think we actually have to technically vote, even though we've moved it, I think we still have to go on record as saying yes.
Okay.
Is there anyone opposed?
Anyone opposed to? Okay. Any abstentions? Okay. Okay, the ayes have it, so the meeting minutes are approved.
That's recording, right?
It is recorded.
It said it was recording. Yeah.
Yes,
Yes, it's recorded.
Okay.
Okay. Next order of business is the chair's report. So officially I have nothing to report. However, I think, first and foremost, I would certainly like to thank Rabbi Kaplan in his absence for his efforts chairing this committee in the past few sessions and for the past few seasons, and certainly do thank this is a difficult task, and so I do thank him for the work that he's done. I also like to thank everyone who has been able to attend both remotely and in person. Next up is discussion of goal setting and priorities. And I think one of the things that had been discussed in the past are some of the challenges that we have in terms of health in hospitals. And the Health Hospitals and Social Services Committee in this area, one, I think we, as it's stated, I think while this Community Board 8 is not as effective with many of the things by virtue of the fact that we do not have a hospital per se, there are a lot of elements of health and public health that are problematic for all of us. Obviously, we know that the Bronx has some of the worst statistics in terms of many things. As a matter of fact, I think it was stated that the first time many young men see a mental health professional is when they're in handcuffs, and I think that's a problem. Just to the south of us, again, we have a lot of trauma, gun and knife violence, And again, while we do not have a hospital, it still affects us. The concerns regarding suicide, and also public health isolation, concerns regarding vaccine and vaccine mandates. So, also, and I think tying into what we'd like to discuss next is the fact that there are lots of other elements of health that do not necessarily require a hospital. And so, I think that one of the goals for this coming session is thinking about how we visualize ourselves in terms of health and what things we can do as a community board in this particular community to help advance health, the health of the community and of New York as a whole. With that in mind, I think I would like to open the floor up so we can start talking a little bit about some of the things that we would that concern us as a community and that we would envision this committee spearheading or assisting in. Is there anyone in the public setting who would like to make a comment?
Hi, good afternoon, good evening. My name is Annie Minguez. I actually live in the community and I also work in the community. And we have some of my colleagues that are also on the line. We wanted to come and participate in this meeting. And I appreciate you all kind of like setting some goals for this year. I had not noticed that we didn't have a hospital. I see we have lots of urgent cares. One of the programs that we run in this district that are within the confines of the community board is an anti-gun violence program in the Kingsbridge area. We've been doing that work for about 10 years. So we wanted to join because we want to also be able to possibly come back and join other nonprofits in presenting here to both the board and also members of the community. So I can always be in touch with you, Chair, to arrange that. So thank you for the opportunity to participate.
Thank you. Thank you so much. I think I won't comment on what happened today, but we know that gun violence is epidemic, and again, I think it's sadly prevalent in the Bronx as well. And I think when we think about health, it's not just it's not just hospitals and bandages. It's also, I think, looking at those preventable elements of health. And I think that that's something that we would certainly love to partner with on. And again, I know I trained at Lincoln, so we've seen a few things, but definitely we'd love to talk more. Thank you.
Sorry. Where should I sit?
I mean, I think, you know, there's a lot of ways that we can define health, right? In addition to gun violence and these other things, a lot of the social determinants of health, the effect of things like Ozempic and what that means for folks, social media on young folks' health. I don't know, I could see the potential, throwing it out into the universe, of like a lot of cross collaboration, especially maybe in months where the calendar gets a little tight, of doing something about health and aging and the isolation, doing something with health and use and talking about social media, doing something about, you know, health and education and, you know, what is it that if it isn't the first time a person of color sees a mental health professional as in cuff, it's probably in school because they've been labeled as a disciplinary problem. That's one of the like, sorry for those of you online that don't know me, I'm a social worker. This is like my whole thing, so I could ramble on. I'm gonna try to keep it brief. But I think, you know, the health of our community is so expansive and the different things that impact it on any given day, right? Even if you wanna, like with social media and the rapidness with which we are receiving the 24-hour news cycle, where it's like, I can't even get off the train before my phone is exploding with messages and did you see and have you heard? And I was, I really don't want to. I would like 5 minutes when I get home. So, you know, Chair DeVita, I think we can define it as in many different ways because there's just so much happening in health and social services, and that was changed.
I just want to add, we'd have to, at some point, discuss things that will impact the borough, and obviously we are going to see a lot of cuts with Medicaid. And Bronx is a borough which uses Medicaid more than any other county in New York State. That's gonna have some real impact on health within our community, both and also within our county. I'm not sure how we are able to, when this bill becomes effective, big beautiful bill, it's going to have a real impact, and we could see achievements that our borough or community board had for many years getting reversed. We probably should discuss how we can help community members who would be affected by these drastic cuts in the coming years. So I think that can be addressed also as a priority.
Absolutely.
Yeah.
I think tied in with that certainly is when you do think about the Medicaid cuts and the aging as well. And so I think there are definitely potentials to tie into, I think, other parts of the community. Mr. Matthews, I don't want to put you on the spot, but, rumor has it you have some expertise in health.
Well, one of the things I think of immediate concern that we could help with is where members of the community can obtain flu shots and COVID shots from pharmacies, or how to go about getting a prescription from their primary care provider. I think we could conceivably conduct a survey of the pharmacies in the zip codes that we cover, find out what their policies are, and provide some information to the Riverdale Press and other media outlets on what's available. Flu season is on top of us. COVID already exists in the community and is likely to get worse as the weather worsens. And I think that's a potentially something we can do immediately. Long range, the availability of services and where and how to obtain them, including social services that are important for social impacts on health, and again, how to where and how to obtain them.
All excellent thoughts so far. Any other thoughts or comments? Again, health is a big umbrella, so, we're not gonna go crazy, because otherwise we'd be here forever, but I'd certainly love to hear any other thoughts or visions that people have for the direction we can take things. All right, so I certainly think that one of the, as I think some of the strong priorities, and I think a lot of places that we can go, but I certainly do think that the idea of starting with flu and COVID shots, particularly considering the changes that certain states have made, would be, I think, a strong priority, and I think that's something that we're gonna work on in the immediate term. Some of these other ideas are certainly things that we can start thinking about long term, and I think we can certainly discuss that and flesh them out a little bit more in the coming months.
I believe our colleague has a
Can I
question.
speak?
Yes, please.
That's not a question. I was gonna say that I worked for 30 years in the City Administration for Children's Services Agency for Child Development. And every child that attends daycare, including the preschool kids in the family daycare, they have to get annual physicals. And years ago, we had nurses or nurses' aides or people that came around to the centers, and they were in charge of screenings, you know, basic
Mhm.
screenings. So if, for example, a kid had a cleft palate or some other thing that had to, a crooked foot, you know, any kind of thing that required further follow-up. And actually, oh, this is being recorded. I'll try to say this. One time we had a 3-year-old with gonorrhea of the mouth.
Mhm.
Okay, so if there's some child abuse that is showing up, the aides and the medical people who came and visited could, identify that and refer for further services. So perhaps one of the things we can ask for, whether we'll get it or not, citywide, would be to have, medical, especially in view of the big, beautiful bill and the cuts. Maybe somehow we can get nurses or nurse trainees, or from some nursing, maybe, excuse me, Hunter College Nursing School or some other nursing school. Maybe we can get them, I don't know, just in this district or around the whole city, to make these kind of screening visits and do some if they're not getting the kind of medical services that we've been accustomed to because of the big, beautiful bill. So maybe we can get some nursing trainees, you know, interns or whatever, give them internships and let them go to all the centers and do screenings with the kids so you can identify orthopedic. We had kids, what's that thing with the club foot, you know?
Mhm.
We had kids sometimes with other kinds of congenital and even heart problems. Kids can have a heart problem at age 3. And so we had kids that had to be referred for various services, most of the time not contagious. And it's always helpful to have that kind of thing. So if we can ask for it, you don't get what you don't ask for.
Okay.
Some referrals to maybe, I don't know who else has a nursing school besides Hunter College, but I'm sure there must be some.
Probably Mercy or something.
Mercy
Yes.
as well, yeah.
Yeah,
I can Google.
Yeah,
Yeah.
maybe.
Yeah, maybe we can give them points on their studies, you know. Some kind, we don't have money in the budget, but maybe we could give them points or some kind of internship credit or, you know, something like that. Where they go to the centers and they check each child's records and see if they've all had what they're supposed to have, or if there are any abnormalities that congenital or otherwise that could be referred for further care.
Oh, excellent. And your name again?
My name is Merritt,
Merritt.
Merritt, and my last name is Claude, like in Santa Claus, but with a D and an E.
Okay. Thank you so much.
Okay.
That's
Yeah.
also excellent.
Yeah, and I worked for 34.5 years in the city administration of children's services, 30 of which was in the daycare programs.
That's wonderful. All right, let's think. All right, again, this is open-ended, and I think that, I think these are all things that we can certainly add on to. Any thoughts about specifics about the first priorities that we should work on?
Dr. DeVito. I'm just thinking some of these priorities that we noted today, maybe we could refine it a little bit more further during the discussions and translate it into budget priorities when it comes to the 28 budget.
I like that idea.
Yeah.
So I think what we will do is as a group, we will start working on fleshing these ideas out and making them something a little bit more concrete. And in the coming meetings, we may kind of discuss this more and get some as a more formal formal document that as opposed to just ideas at this point in time. So. All right, I think moving on, we have Mr. Pultinas, who's here from the James Baldwin Outdoor Learning Center. And so he is here with a SAPO application for a rally coming up. So the first note on this SAPO application is that this is actually set for Saturday, September 13th, not the 16th. But with that, I would certainly like Mr. Pultinas to have the opportunity to tell us a little bit more about this organization and the event, as well as this application.
Great, yeah, thank you and greetings, everyone. So it really boils down to this little word on our flyer, rally. And I was trying to do due diligence and get a permit for something that we really do all the time at the James Baldwin Outdoor Learning Center and Farmers Market, which is doing programming, open mics. We have music, we have a lot of, speaking of health, I mean, this is the perfect committee to tell you about our space. In that, we do provide a lot of programming for young children, families, elders in the community, including, things like yoga, mindful meditation, chair yoga, gardening, herbalism, and all of those, I also am happy to be here after 5 years because we started the farmer's market and our first SAPO permit was in 2020. So it was thanks to you guys that approved that initial application. And 5 years later, we've just evolved tremendously, and I want to, thank you for helping us get going. In regards to the event on Saturday, it's really it's the third time we're doing it. It's the Air We Share Town Hall. We are partnering with a KTC, Kruger Transit Consulting, is a company out of San Francisco and West Coast. They are bringing or starting a fleet of hydrogen fuel cell buses in the Bronx. And as you know, the Bronx is the highest asthma rate in the New York City and as well as in most of the country. So these buses are really, going to have an impact and cut down on emissions, zero emission and clean energy. And so this town hall is really a way of kind of getting the word out to the community that these buses are on their way. The reason I added the word rally is because I wanted to entice young people, because really, that's the audience that I think truly is representing the future. And I want to engage them. And just today, we were able to get a youth on the panel from Bronx Community College who is going to speak out. Also, Senator Gustavo Rivera is going to be on the panel. He's chair of the Health Committee. Trying to do due diligence, I went on and tried to get the, thinking that we would need a special permit for the rally. I went on the SAPO in order to do that. I wasn't able to get that date, so that's why the Wednesday, the 16th came up. And it was the first available date, so I figured, oh, I'll need a permit and maybe we'll be able to get the date changed. So the cutting to the point, we're doing nothing unusual that we wouldn't do on any normal day at the farmer's market, for which we already have a SAPO permit. And this one, we've had it for 5 years. So it was an error on my part to try to get the special permit for the rally. But it sent me here, and that's why I got a chance to thank you personally for really getting us started 5 years ago during COVID. I attended this meeting, I think, in a mask. That's
2020.
Yeah, but that was at a time when people were really desperate. They were in quarantine. They wanted a safe place to purchase their produce and vegetables and healthy items, and we provided it. And as a result, we've now have a real dedicated community following.
And this is the third time you've been doing this. Is
Correct. Yeah.
Have you had any issues with the community before in terms of proposal, any police issues,
Yeah, we've never had
any
any,
complaints from anyone in the community?
I have. So the traffic is, there's no, usually you close,
it's, yeah, that's also,
cause it says full, is it a full street closure?
yeah, no, it is not. It's already, we applied back in 2018, for a DOT pedestrian plaza. It was actually granted to us in the fall of, 2024. And now it has become a DOT plaza. We were able to name it James Baldwin Plaza. James Baldwin was a graduate of DeWitt Clinton, class of 42. I was an English teacher before I got into sustainability and gardening and healthy eating. We only serve vegetarian and vegan food at the market. So we're also trying to get people to eat healthier. And in fact, most of our programming doesn't even take place on the plaza. So it's not a obstruction to.
So there's no
Traffic.
traffic obstruction at all, okay.
None whatsoever.
I'd like to ask some questions, if it's a possibility. Okay, you know the television channel 12, I think, or what's that other channel that they have all these? Have you tried to speak on that, to explain about it?
We've been, yes, I did send a press release to, News 12, so hopefully they'll cover the event.
No. So, do you have any other publicity on it?
I have a press release,
Which went where?
which went to the, Norwood News, Riverdale Press, BronxNet.
How about the colleges like Marymount and the other colleges, Manhattan and, you said others colleges.
I did reach
Lehman
out,
and all-
I did reach out to our contacts, we have them at Manhattan, we just did an event with, Fordham,
Yeah.
as well. Yeah,
Yeah.
yeah. And Bronx Community College, where
Yes.
we hosted a How Things Work conference,
Mhm.
earlier in the year. They've also been responsive and, contributed
How many
students.
staff are running your thing?
We're all volunteers, mostly it's my wife. We're a nonprofit, 501c3 nonprofit. And, yeah, we've just been growing in popularity. Hello.
I just, you know, if you're seeking additional staff, that would also be just to put in on your stuff to all those locations that you're, you know, asking for volunteers and blah, blah, blah. I
Yes.
mean, it doesn't cost anything if you're running out to these
That's right.
501c3 organizations and colleges and so forth to stick that into.
And can I share these with the rest of you? John?
Thank you.
And I think, it was recommended that I send you
I'm gonna leave this so that they post it on our website.
Okay, great.
Oh,
If I send it to
that's
Sarah,
what I
is
She'll put it
that-
on the.
okay, good, I'll send her the
Yeah.
PDF, the chase.
And the colleges, all the colleges, you
Yes,
know,
yeah, Lehman,
even some of the high schools, Bronx Science,
yeah, I taught at DeWitt Clinton for
my
30
uncle
years.
went there,
Okay. Yeah, yeah, but,
but he was in World War II.
yeah.
He was a little older than
Yeah,
that.
sure.
But I think that they've, but thank you for that point, because again, I think it is
The
important.
high schools too,
Mhm.
yes,
It's,
all the colleges.
yes,
Yeah.
but I think point's taken. I think it is, no, it is important that I think particularly for events involved in the community that people are aware, but
And the television thing, you know,
is there, I think he stated that they've notified them as well.
you don't get what you don't ask for.
Absolutely, absolutely. I would like to take this moment, opportunity this moment to thank again, Rabbi Kaplan. And again, thank you for coming and also thank you for.
It's paper, yeah.
The meeting went a little bit long.
Rabbi. And also, I want to thank you again for you.
And let me officially, you can just pass this over to you, as it, the keys to the thing.
All right, so that being said, is there any other discussion regarding this SAPO application?
I move to close discussion.
Discussion's been closed. Do we have a motion to vote on this application?
Motion.
Okay. Do we have a second? Second. All those, anyone opposed to the SAPO application? Any abstentions? This application has been approved with the note that this is going to occur on the 13th.
13.
Saturday the 13th, not the 16th.
Uh-oh. I know.
And from 10 to 3.
Yes, yeah. The Speak Out rally, starts at noon, and the panel discussion should start at 1:30. And we have a number of, experts on that panel.
But besides talking, you're gonna have some stuff with the fruit and all that?
Oh, yeah, we still have our farmer's market. Yeah, absolutely. Cooking demos, free food. Thank you so much. Please come.
Excellent. Next up, is the matter of unfinished business. And I do not believe that there is any there's no new business at this point. I need no unfinished business at this point in time. Any new business? All right, so, at this point, I think the topics that we will be focusing on and then will be coming to you in the future will be discussions of the goals, for this committee. And, I would like to take the opportunity to ask Rabbi Kaplan if if he has any thoughts.
Well, first of all, it's really very heartening to see so many folks here. It was an issue that we had last year was attendance, and I'm glad that there's so many folks here today. One of the issues that we really were focusing down on, and something that I think is in the world we're living in today, particularly with today's events, is the issue of mental health and trauma. We are in the most polarized state of situation according to data since the Civil War, and I think it's taking a toll on everybody. Really a tremendous toll on everyone. And the more that I study the skills of working with people in a traumatized situation, I see it so evident in many of the decisions that are being made, many of the ways that we're approaching problems within our society. And I can just tell you that healthcare, unfortunately, is not approaching it in a very thoughtful and constructive way. There are more and more cuts coming down, and one of the big areas that's going to be cut tremendously is the area of mental health. So I would hope that this committee would continue to focus on mental health as an issue, and bring in as many resources into our community as possible to help folks navigate the world around them as it is right now.
Are we able to speak on that?
Thank you for the Dr.
Speak on that? No.
We will allow it, sure.
Okay, well, right now, we're having a problem that, the movement in the country is now to warehouse the people with mental health. They're going back to all the time when they would put them in some kind of like a cell structure, it's equivalent to, a jail, so that they don't kill anybody else, which has unfortunately happened on many occasions. But, in terms of mental health, that doesn't give them any, way to get better. So I think we should be aware of that. I don't know exactly what we can do about it, but the movement at present, if I'm reading the Ouija board, the way it looks like it's going, we're gonna be moving towards warehousing people with mental health. Of course, who decides who's the person who has the mental health situation that warrants that kind of thing? And are the people getting any services appropriately? And, it raises a whole lot of questions concerning what he was saying.
Absolutely. I think, as we all know, I think.
I know I'm not inventing the wheel, but.
Well, no, I mean, the reality is, the absence or substandard, care in terms of mental health is in fact very problematic.
Yeah, it's
And
gonna
there's-
get worse.
And there's a lot of evidence that, again, I think when we stop appropriately treating mental health, I think we started to see the explosion of many other issues, particularly homelessness, et cetera. So I
Violence.
think,
Dr. Lee,
yes,
I wanna and I'll be very transparent here, because I think it's important to do. I have depression and anxiety. That's something I've struggled with since I was a child. So I think it's really important to be very clear about the fact that the person, a mentally ill person, is most likely to hurt is themselves. That's not my opinion, that is a statistical fact that you can research. We all have Google, I won't get into the studies, because again, the data nerd in me wants to. But I just want to be really clear, because there's a lot of this language around every time there's a shooter, they're mentally ill, and while we all have trauma, and we all, it's not that all mentally ill people are violent, and you are much less likely to be hurt by a mentally ill
Yes.
person, they're much more likely to hurt themselves.
Absolutely.
Interesting.
No, absolutely, and I think, again, the key is to not demonize, mental health. It is an aspect of healthcare. And again, the key is, again, ensuring that individuals have the resources and services that they need, and recognizing that mental health is a spectrum. And that, it has issues with those who've been affected by trauma and violence, those who, have substance abuse, those who have other organic, mental and psychiatric disorders. And again, recognizing that it's not necessarily a separate entity, it's something that needs to be included as all of health. And also recognizing that isolation, particularly when it comes to the age, again, when you talk about issues with social media and fear and concern. So it's a big comprehensive thing. And we gotta recognize that it is important. And I think, as has been stated in many ways, it seems apparent that one of the strong thrusts of this committee needs to be, recognizing the importance of mental health and making sure that there are appropriate resources to take care of individuals. And in all aspects, whether it's ensuring that they have appropriate care, dealing with suicide prevention, recognizing when people are in need. And so I think that's what, as we go forward and start working on our priorities as a committee, I think that one of the things that will definitely come up is that, and we will be working on that, and I look forward to contributions of all members of the committee and the community.
Can I just say, I want to thank you, Julia, for sharing. Because that really makes, at least it made me, like really think a little bit more when you talk about the subject.
Well, and to be totally transparent, that's why I
Yeah.
did, right? Like,
I thank you for that.
I don't think people look at me and automatically think like this is something I've struggled
Yeah.
with. I've been medicated for
But I
anxiety.
would know.
Right, but that's the point, is people think that it's the person on the subway that's scaring them.
Right.
Probably, but it's also someone you sit next to, it's someone you work with, it's your kid's best friend, it's the number of young people.
And the elderly now.
And the elderly, a
When
lot
you-
of
when you get older, some of the people.
the Alzheimer's and the
Yeah.
dementia, and, you know.
And when you can come out like that, not that it normalizes, but it makes other people have the power to also say, well, me too, so that the public won't see the negative. Thank you.
Yeah, and I've been blessed to have the love and support of my family and friends, and Dr. DeBeetham has known this about me for a while, so I feel safe saying that in these spaces, and I think it's important for someone to do it, to kind of lead the way.
Thank you for sharing, and again, I think your contributions are important. That being said, I don't believe we have any additional new business. Are there any other specific concerns before this committee?
Can I speak?
Regarding,
Medical insurance.
I think we will put that under the topic of, I think it was also mentioned briefly, but I think we'll put that under the topic of, things,
Something else.
the topics to discuss,
At a future time.
in the future time, as I
Okay.
think, our committee member Sebastian had mentioned, again, one of the concerns with Medicaid and the cuts, and so I think that that's a topic that will definitely be part of our future thrust. That being said, do we have a motion to adjourn?
So moved.
Second.
Okay.
Okay.
So with that, thank you everyone for attending. And I believe that we currently do not have a meeting scheduled for October, given the preponderance of holidays that month. If in the interim, we see an opportunity to liaise with another committee, we will let you know. And we will tentatively be meeting again in November. Thank you so much.
Thank you.
Thank you.
Thank you.
I want to thank, Wayne